It's 2 p.m. on a Tuesday, you're sitting at your desk, maybe you're just replying to an email, or maybe you're standing up to grab a glass of water, and then out of nowhere it happens: thud, 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 thud. Your heart isn't just beating, it feels like it's trying to punch its way out of your chest. And the first thing your brain does, it panics. It asks, is this it? Is my cortisol too low? Is this an adrenal crisis? Or did I just drink too much coffee? That spiraling thought process is almost universal for people with adrenal insufficiency. It's that instant jump from, I feel a flutter, to, am I in danger? And honestly, Rachel, that uncertainty is often heavier than the symptom itself.
Exactly. And that is exactly what we are unpacking today. We're looking at an article from My Adrenal Life titled Heart Palpitations and Adrenal Insufficiency: Why They Happen, What They Can Mean, and How to Understand Them Safely. This isn't just about heartbeats, it's about decoding one of the most unsettling signals your body sends you. I'm Jake.
And I'm Rachel, and I think we need to start by validating something the article brings up right away: the sheer confusion of it all. Because if you go to a cardiologist and say, my heart is racing, they might look at your EKG and say, you're fine, it's just anxiety. But in the context of adrenal insufficiency, whether that's Addison's disease, secondary AI, or steroid-induced, that racing heart is often a very specific physiological language.
Right, it's not just nerves, it's communication. So let's get into the mechanics. The article makes a really interesting distinction. It says that in adrenal insufficiency, the palpitation isn't usually the problem, it's the compensation. What does that actually mean?
Think of your heart as the engine room of a ship. If the ship starts leaking fuel, or in this case, if your blood pressure drops or your blood volume gets low, the engine has to rev harder just to keep the ship moving at the same speed. In adrenal insufficiency, you lack cortisol and often aldosterone. These hormones are critical for maintaining blood pressure and fluid volume. When those drop, your vessels relax too much or your blood volume shrinks. Your heart senses that drop and says, oh no, we're losing pressure. I need to pump faster and harder to get blood to the brain.
Which explains why so many people feel this specifically in the shower or when they're overheated. The heat dilates the vessels even more, making the heart work double time. But Rachel, we have to talk about the different types of AI here, because the article is very clear that a person with Addison's, primary AI, is dealing with a slightly different beast than someone with secondary AI. Why does that distinction matter for palpitations?
It matters immensely because of the electrolytes. In primary adrenal insufficiency, or Addison's, the adrenal glands are damaged, so you usually lose two hormones, cortisol and aldosterone. Aldosterone is the salt keeper. Its job is to tell your kidneys, keep the sodium, pee out the potassium.
And if you don't have aldosterone?
You do the opposite. You lose salt and water, which leads to dehydration. That drops your blood volume and triggers that racing heart we just talked about. But, and this is the scary part, you also hold on to potassium. High potassium, or hyperkalemia, is a direct irritant to the heart's electrical system. It can make the rhythm feel heavy, irregular, or erratic.
Okay, that sounds serious. So for someone with primary AI, a palpitation could be a sign of a potassium spike?
It can be, yes. That's why for primary patients, salt craving and dehydration are such huge red flags. But for secondary or steroid-induced AI, the pituitary gland is the issue, so aldosterone is usually preserved. Their sodium and potassium might be perfectly normal on a blood test, but they still get palpitations. Why? Because of the cortisol drop itself.
Because cortisol affects blood sugar too, right? I feel like we underestimate how much glucose plays a role in how our heart feels.
Huge role. Cortisol helps release stored glucose. If your cortisol is low, your blood sugar can crash. When blood sugar crashes, your body releases adrenaline to try and mobilize sugar. Adrenaline is a stimulant. So you're sitting there, your sugar drops to 60 or 50, and suddenly, boom! Racing heart, sweating, shaking. It feels like a panic attack, but it's actually a fuel crisis.
That distinction is so validating. I can't tell you how many people describe that sensation as emotional, like they just feel sudden dread. But hearing that it's actually a chemical dump of adrenaline because your body is starving for fuel, that changes how you respond to it. You don't need to meditate, you need a juice box.
Exactly. You can't deep breathe your way out of hypoglycemia. And that's really the core message of this My Adrenal Life piece. Context is safety. If you know why the palpitation is happening, you stop fearing the sensation and start treating the cause. If it's dehydration, you drink electrolytes. If it's sugar, you eat. If it's low cortisol, you updose.
But that brings us to the hardest part, Rachel, the uncertainty. The article hits on this idea that sometimes you check your blood pressure and it's normal. You check your sugar, it's 90. You check your heart rate and it's maybe 85, not even that high, but you still feel terrible. You still feel that fluttering, skipping sensation. What is happening there?
This is where we get into what the article calls autonomic stress, or body overload. We have to remember that lab tests are snapshots. They tell you what is happening in that exact second. But your body feels the trend. Maybe your cortisol is dropping rapidly. Even if it hasn't hit 0 yet, your body senses the slope of the crash before the crash lands. The palpitation can be a pre-tremor.
So the body is an early warning system.
It is. And sometimes it's just exhaustion. If you've been ill or you didn't sleep well, your nervous system is raw. The threshold for feeling your own heartbeat lowers. You know how when you're really hungover or fluish, you can hear your pulse in your ears? Adrenal insufficiency can create a chronic version of that sensitivity.
That makes so much sense. It's like the volume knob on your internal sensors is turned all the way up. Now, I want to pivot to the tech side of this because the article spends a good chunk of time discussing wearables, Apple Watches, Fitbits, Garmin's. This is a double-edged sword, isn't it? Because on one hand, data is power. On the other hand, staring at your wrist every 30 seconds sounds like a recipe for neurosis.
It absolutely can be. We call it the nocebo effect of wearables, where seeing a number makes you feel worse. But the article argues for a grounded approach. The value isn't in obsessing over a single spike, it's in seeing the pattern. For example, if you notice that every time you feel that crashy feeling, your heart rate has jumped 30 beats per minute, that's data. That validates that you aren't imagining it. It's orthostatic.
Right. It moves the conversation with your doctor from, I feel weird, to my heart rate spikes to 130 every time I shower. That's clinically useful.
Exactly. And the article specifically highlights an app called Cali. I found this fascinating because it addresses a specific frustration with the Apple Watch.
The dreaded inconclusive reading.
The inconclusive reading, yes. If your heart rate is too high or too low, or if you have a lot of extra beats, which are often benign, the automated algorithm on the watch just throws its hands up. It can't tell you what's wrong, so it just says inconclusive. For an AI patient, that word is terrifying.
It sounds like undiagnosed danger.
Right, but Quali is different because it connects you to human technicians. You upload that confusing ECG, and a certified technician looks at it and says, hey, this is actually just a few PVCs. It's benign. Or this looks like sinus tachycardia, which just means a fast, normal rhythm. The article points out that for someone with adrenal insufficiency, knowing that a rhythm is benign, even if it feels scary, is the difference between an ER trip and just drinking some salty water and lying down.
That is huge. It effectively outsources the anxiety. Instead of you guessing, a human expert says, I see it and it's not dangerous. That breaks the panic loop we talked about at the beginning.
And breaking that loop is physiological, Jake, because panic uses up cortisol. If you spiral into a panic attack over a benign palpitation, you are burning through the very hormone you are already low on. Calming down is actually a cortisol-sparing strategy.
Wow, I hadn't thought about it that way. Panic is expensive, biologically expensive.
It's very expensive. That's why these tools, when used correctly, are part of your management toolkit. They aren't just gadgets.
Let's talk about safety, though, because we don't want to give the impression that every palpitation is fine. The article has a specific section on when palpitations need urgent attention. What are the red flags where we stop analyzing and start driving to the hospital?
The big one is context, palpitations plus other symptoms.
If you have palpitations and you are vomiting, if you have palpitations and you are confused or slurring your words, if you have palpitations and severe weakness, like you can't lift your arms to wash your hair, those are signs of an impending adrenal crisis. The heart symptom is just one part of the system shutting down. In those cases, you inject your emergency hydrocortisone and you get help. Period.
Right, the palpitation alone might be a warning, but the palpitation plus vomiting is a siren.
Exactly. And also chest pain. We can never ignore chest pain, even if you have AI. People with AI can still have regular heart attacks or other cardiac issues. Don't tunnel vision so hard on the adrenal glands that you miss a standard cardiac event. If it hurts, or if you feel pressure, you get checked out.
That's a really important balance. It's about being informed, not complacent. I want to circle back to something the article touched on briefly, but I think is so relevant for the listeners. The concept of recovery instability. It mentions that palpitations can appear during recovery after illness. Why is that?
Oh, this is the classic "I thought I was better" trap. When you have the flu or a stomach bug, you double or triple your steroid dose. You feel awful. Then the fever breaks, and you think, great, back to normal. You drop your dose back to baseline. But your body has been running a marathon. It's depleted of nutrients, it's dehydrated, and its reserves are empty. When you drop that adrenal support too fast, the heart is often the first thing to complain. It's saying, we aren't ready, we're still rebuilding.
So the palpitations in that recovery week are almost a sign of dragging the anchor?
Yes, it's a sign you're under-replacing for the recovery phase, even if the acute illness is gone. The article suggests that this is a time to be very gentle with yourself. Maybe you don't drop to baseline immediately, maybe you taper down slower, and you definitely focus on hydration.
This really reinforces the idea that managing adrenal insufficiency is an art as much as a science. The textbook says 3 days of double dose, but your body might say, I need 5 days. And the palpitations are the voice of your body making that request.
That's beautiful, Jake. It really is a voice. And I think that's the most empowering takeaway from this My Adrenal Life article. It reframes the symptom. Instead of viewing the palpitations as this random, scary enemy attacking you, view them as a dashboard light. It's blinking yellow. It's telling you, check fluids, check salt, check sugar, check rest. It's giving you instructions.
It turns the fear into action. Instead of I'm dying, it's I need a salty snack and a nap.
For the vast majority of episodes, yes. And for the ones that aren't fixed by that, you have your emergency plan. You have your doctor. You aren't helpless.
I love that. Before we wrap up, I want to touch on one last thing from the article, the emotional validation. The author writes, you are learning your body in a way most people never have to. That really stuck with me.
It's a profound burden, isn't it? Most people walk around never knowing what their blood pressure is doing, never thinking about sodium channels. If you have AI, you are forced to become a physiologist of your own body. It's exhausting. And I think acknowledging that exhaustion is part of the healing. It's okay to be tired of managing it. It's okay to be frustrated that you can't just stand up quickly without thinking about it. That frustration is valid.
And you're not crazy for feeling shaken when your heart flips. It is scary. But as we've learned today, it's also explainable, physiological, manageable.
Knowledge lowers the fear every time.
Rachel, this has been such a helpful deep dive. We've gone from the mechanics of blood volume all the way to the psychology of using an Apple Watch without losing your mind. If listeners want to really dig into this, I highly recommend reading the full article on My Adrenal Life. It breaks down the specific apps like Qly and Cardiogram in more detail than we could get to here.
Absolutely. It's a great resource to have bookmarked on your phone for those moments when you need a reality check.
Thank you so much for breaking this down with us, Rachel.
Thanks for having me, Jake.
And to everyone listening, if you found this episode helpful, or if you know someone navigating life with adrenal insufficiency who could use a little less uncertainty and a little more confidence, send this their way. Sometimes the best medicine is just knowing you aren't the only one feeling that flutter.